The Democratic Nursing Organization of South Africa is calling on President Cyril Ramaphosa to intervene in the plight of frontline health workers. The union has written an open letter to the president to address what it calls the devastating effects of COVID-19 on nurses. Their grievances include the failure to increase public servant salaries in April, as well as shortage of staff and equipment. We're joined now by Denosa President Hlungwani. Mr. Hlungwani, thank you very much for joining us. First of all, I've seen some of the things that you are demanding from the president in the letter dated 11th September. Just for the viewers, tell us exactly what it is that Denosa is demanding from President Cyril Ramaphosa.
Well, firstly, we thank you very much for having us, but we are saying first, the president must not take it as if it's business as usual when nurses are dying from COVID-19. Therefore, we are demanding that the president intervene in the areas that are of the plight of nurses and other health workers. One is that we need a wage increase that is due to us, and as per the agreement of Resolution 1 of 2018. We have also made a call for Department of Health or the employer to provide nurses with risk allowance, just as other countries have done. Zimbabwe is giving risk allowance. In America, the state of Louisiana is giving danger allowance. In Ghana, they are giving tax break for nurses for 3 months. Now, we are saying it can't be that the workforce in terms of health, and particularly nurses, are going to be left as the only people in South Africa that are not cushioned with regard to the problems of COVID-19. And we know that around 270 of them have died. More than 27,000 have contracted COVID-19. Now, the president, we are appealing to his conscience to take this as not as a normal business as usual, because we are feeling demoralized, and we think he can do something to intervene, because we have placed the demand for danger allowance in May, but to date it's more than 5 months. We are now in month number 6. The Department of Health, their representatives are still coming back as the employer, saying they don't have a mandate. And we're saying that cannot be normal in a state where we have a crisis, and we're asking and demanding that the president must intervene in this regard.
Now, you say that you started speaking to the employer 4 months ago. If you're saying May, it's been 4 months. Now you've, tried another avenue by speaking to the president. When do you expect to get an answer, and what are you hoping for from the presidency?
Well, we are currently hoping that the president can respond within a week, because we gave him that letter last week, and we are aware that the president is going to address the state. We are hoping that, and we are demanding that in his address, he must address this matter, because if he doesn't address it, it means he doesn't think nurses are actually very important in the country. We are calling upon the president to follow the route of Joe Biden, who is the candidate for president in America. He said it's not enough to thank the health workers, but they must also be remunerated equally, so that the appreciation is seen in monetary value as well. But we just want to emphasize that in the past, during the COVID-19, nurses were spending even more money in terms of transport, because the taxis were making us pay more money than the normal prices, because they were not full. And we were never, ever at all been mitigated. No transport was provided. Things were tough. We also have families. We are struggling, and we're even assisting our own families that have become unemployed, and it's a difficult situation, but we're never cushioned. We know businesses have been cushioned by government, unemployed people have been cushioned, which we appreciate. We are just saying, how about us as nurses, but also as public health, as well as the public servants? We can't just be told that you deserve nothing during this difficult time and this pandemic. We are feeling the effects of that, and we demand that the president must intervene in this regard. We are appealing to his conscience. If he doesn't respond, it will simply mean that indeed they don't take nurses as anything in this country, and therefore anything that may come after that, we cannot be held accountable for that.
Mr. Hlungwani, I just want to know specifically with Nehawu. I'm sure you know that union had a meeting yesterday, and they've been going on these small strikes across many parts of the country. They've also written to different premiers and MECs of health across the country, and they are basically planning that their members will down tools. Do you support that strike? If it happens, would you support it?
We are in a process of the COSATU JMC, where we are saying if these matters are not being addressed, our employer in this regard will see what is coming to them. The program will be unfolding. We are working as the JMC of COSATU, it's a joint mandating committee of COSATU that agrees that nurses must be given danger allowance. It agrees that we are due to receive our wage increase for this year, and government and the employer has not responded to that regard. And we think that, because COVID-19 and the restrictions were there, we know that those restrictions are going to come to an end, and we're going to have a full-blown action where we're going to show the employer that should not be taken as if we are nothing in this country.
Thank you very much. Denosa's Howard Hlungwani speaking to us there. Thank you, sir.